This module is about the A in PACE, which stands for Agitation and Aggression. As a healthcare worker, many of you have experienced violence in the workplace that resulted in injuries. Injuries caused by pinches, punches, scratches, bites, kicks, grabs, and other acts of violence from clients. The subject matter in this module is difficult because violent acts by the clients you care for are often not intentional. They can result from an underlying medical condition or sensitivities beyond their control. Think of a client's agitation and aggression as the tip of an iceberg. You need to look at what's beneath the surface. Many clients who exhibit violent behavior suffer from a cognitive impairment. These impairments can make them resort to challenging behavior when they experience unmet needs. Unmet needs may include experiencing pain, hunger, thirst, low energy, or the need to use the washroom. Perhaps they are tasting, smelling, or hearing something unfamiliar. Sometimes they are just feeling generally uncomfortable. In addition to unmet needs, unrecognized triggers can also be responsible for a client's challenging or violent behavior. Unrecognized triggers can be more difficult to detect. That's because even though you're doing everything correctly as a healthcare worker, the triggers may consist of things that are much more subjective and difficult to address. These can include things like wearing your hair differently, or that you wear glasses. It could even be the tone of your voice, or your gender. Because some triggers can be difficult or impossible to address, great care must be taken when assessing a client's likelihood of violent behavior. To do this, we must pay careful attention to the client's verbal and nonverbal cues. Verbal cues can include the client's speech patterns, such as tone, volume, and language choice. Nonverbal cues can include things such as threatening body language and expressions, or a refusal to communicate at all. And most importantly, you need to acknowledge the client's personal history of challenging behavior. As with all PACE components, using this assessment technique will help you determine if it is okay to proceed with caution, or stop and get assistance. It is okay to proceed if the client isn't agitated or aggressive, and this is not expected to change, as they do not have a history of challenging behavior. You need to proceed with caution if the client has a history of challenging behavior. This means they're unpredictable, even if they don't seem agitated. If the client is exhibiting mild forms of challenging behavior, but risk is not imminent, it may be time to use your training to determine if they have any unmet needs or are experiencing an unrecognized trigger. If the client is exhibiting signs of agitated or aggressive behavior, it may be time to stop and get assistance. This is when you should find a safe place to contact your immediate supervisor to determine next steps. Healthcare work is changing. The people you care for are older with more complex and challenging health issues. This is the reality, and we can't change it. What can't continue being your reality is suffering injuries at work due to client agitation and aggression. By using PACE properly when assessing your client's behavior, we can help make sure that your clients receive the care they need and healthcare workers are able to do their jobs safe from injury.